Now we are going to read adaptation of cellular growth and differentiation. Growth and differentiation. Basically, what are adaptations? Adaptations are whenever cell undergo any injury, then the cell undergoes some changes. They adapt themselves to sustain themselves in the stressful condition, and in that one is adaptation. And adaptation are, so we will write adaptation are the reversible changes. Once stressed condition is over, they will be in their normal condition. Adaptation are reversible changes, and the changes are in the size, number, phenotype, metabolic activities, function of cell in response to change in the environment. There are many adaptation which are going to look, and the adaptation which we are going to look, that they have several distinct forms. Adaptation may take in the several distinct form, and the examples are: A is hypertrophy, B is hyperplasia, C is atrophy, and D is metaplasia. First we will look about hypertrophy. Hypertrophy, that means that increase in size of cell, and due to increase in size of cell, there is increase in size of affected organs. Hypertrophy that do not means that have new cells, means that have no new cells. They are the condition in which the cell become the large, just large cell. And why there is increase in size of cell? Increase in size of cell is due to synthesis and assembly of additional intracellular structural compounds. Intracellular structural components. Hypertrophy that can be physiological or pathological. Or pathological. Now we will look about the physiological. We will look about the physiological hypertrophy. Basically, the physiological hypertrophy is mainly due to the increased functional demand or stimulation by hormones and growth factor and growth factors. So let's look about the physiological hypertrophy. Physiological hypertrophy. Due to hormone, there is due to hormone, I mean to say there is massive physiological growth of the uterus during pregnancy. And this is very good example of hormone induced enlargement of organ. In this, what occurs? There is hypertrophy, of smooth muscle fiber. And how this uterus hypertrophy occurred during pregnancy? This is due to estrogenic hormone stimulating the estrogen receptor, and that cause increased synthesis of a smooth muscle protein and increased cell size. After this physiological hypertrophy, now we will look about pathological hypertrophy. As we know, there is the striated muscle cell which is present in heart, in a skeletal muscle that has limited capacity of division. So when there is increased metabolic demand, the cell undergo hypertrophy. So the most common stimulus for hypertrophy of skeletal cardiac muscles are what? Increased workload. So we will write that there is increasement of workload, and that is the most common. Stimulus for hypertrophy of a skeletal and cardiac muscle. What occurs when there is hypertrophy of a skeletal and cardiac muscle? In this, what occurs? That the muscle cell respond by increasing the synthesis of more protein and number of myofilament per cell. And then this increases amount of force each myocyte generate, and so the strength and workload of the muscle increases. This is all about the pathological hypertrophy. And when we look about the pathological hypertrophy, that is the heart. That is the classical example of the pathological hypertrophy in response to pressure overload. And you can write that when you will see like example in hypertension, valvular diseases. What the thing is that do the cardiac hypertrophy improves everything? Then cardiac hypertrophy improves the function, but after time this adaptation fails, and that lead to heart failure and very big pathology of heart disease occurs. Now we will look about the mechanism of hypertrophy. Basically, what does hypertrophy mean? Hypertrophy is the result of increased cellular protein production. We are reading about the mechanism of hypertrophy because after sometimes this hypertrophy become maladaptive. Okay, so and how this hypertrophy occur? Hypertrophy basically results from the action of growth hormone or direct effect on cellular protein. So we will write here that how why hypertrophy occur. Then hypertrophy results from the action of growth factor and direct effect on cellular protein. Now how it is the mechanism of hypertrophy started? Like example it can say it is the process like mechanical sensors, means there is increased workload and mechanical sensor in cell detects the increased load, and after that the sensor has sensed that there is increased load. Then the sensor activates a complex downstream web of signaling pathway that include the PI3K. You can write that mechanical sensor in cell detect the increased load, then cell activate करता है एक pathway को that include the PI3K, that is called phosphositate 3 kinase or AKT pathway. It is basically this mechanical sensor. When there is mechanical sensor, this gene get activated, and this get activated in physiological process. What do I mean by physiological? Example, you are doing exercise induced, and this is one. And second is then when mechanical sensor that sense, then there is activation of G protein coupled receptor pathway, and that is activated by many growth factor and vasoactive agents. And this one is basically important in pathological hypertrophy. So by two ways, one is by in physiological process, that P13K, that is phosphoninositide 3 kinase pathway or AKT pathways get activated, and one is G protein coupled receptor initiated pathway, and that get activated by many growth factor. It is in the pathological process, and vasoactive agent, this is also in pathological hypertrophy. And this both pathway, the P13K pathway induced and G protein coupled receptor initiated pathway, both of this pathway activate the transcription factor, and that including GATA4, then NFAT. You can remember that NFAT. And what is the full form of this? Nuclear factor of activated T cell, and MEF2, that myocyte enhanced factor 2. and when this factor get activated, transcription factor, here it is written transcription factor get activated, then this lead to increase in expression of genes that encode muscle proteins. And this cardiac hypertrophy, that's when there is expression of gene, and if there is increase in expression of gene, what will it lead to? What are the effects which it will cause? First of all, this will lead to switch of gene. They will switch the gene that is encoding for the adult type contractile protein. It will switch to gene switch to gene that is जो कि बच्चा वाला जो fetal isoform का जो प्रोटीन बनाना था उसमें स्विच हो जाएगा from the adult type. So I will write here switch to genes that encode functionally the distinct fetal isoform of the same protein. Okay, example is that alpha form of myosin heavy chain that is replaced by beta. You can write example also. Example is alpha isoform of myosin heavy chain that is replaced by beta isoform. And if it is get changed to beta isoform, what are the changes which occurred? This led to slower, more energetic contraction. Other genes, one gene is that it will encode the functionally distinct fetal form of same protein, and the second thing is that when there is hypertrophic myocardial cell, then they are the genes that is coding for the atrial nucleotide factor. It means I mean to say that cardiac hypertrophy जब होता है तो उसमें increased atrial natriuretic factor gene expression. And what this cause? This create the salt retention, cause salt secretion by kidney, that is decreased blood volume, decreased blood pressure, and then this lead to decreased hemodynamic load. Okay, after that all this will occur. Then if there is the heart is doing whatever possible changes in the myocardium, but when there is extreme cases, then myocardial death can occur. So this is all about the if a body has a stress, there is adaptation, and if that stress is not relieved in some days, some weeks, some months, then eventually if it will lead to cell injury, cell death in further time. So this was all about the hypertrophy. Now let's look about hyperplasia. What does hyperplasia mean? Hyperplasia means that increase in the number of cell in an organ or the tissue in response to a stimulus. Hyperplasia, this is hyperplasia. Earlier we have studied the hypertrophy. Both are very distinct process, but they could occur frequently together. Means they in the body they frequently occur together. Okay, and they can be triggered by some they are occurring together because they may be triggered by some external stimuli, and that is same. Okay. And hyperplasia occur only if, it's important that it not occur everywhere, occur only if tissue contain cells which are capable of dividing, and thus increasing the number of cells. And this can be this again can be physiological or pathological. Now let's look about the physiological hyperplasia. Logical hyperplasia. Why this physiological hyperplasia occur? This occur due to action of hormones, or the growth factor. Okay. When there is need of, occur due to action of, it occur due to hormone के कारण होता है, growth factor के कारण होता है, जब वहाँ पे when there is need to increase the functional capacity of hormone sensitive organ, or there is need, means there is some damage occur, resection occur, and then is compensate, there is need for compensatory increase after damage or resection. Okay, this is the physiological hyperplasia. This basically occur due to hormone or growth factor. The hyperplasia example, we can say that basically we have learned the hormonal, so we will write the hormonal hyperplasia. And that is illustrated by the example is the proliferation of the glandular epithelium of the female breast at puberty and during pregnancy, and this is due to accompanied by the enlargement of glandular epithelial cell. And the classical example that come in this is the hormonal hyperplasia. Now we will look about the classical example. If anyone asks about that, what is the classical example of hyperplasia, that we will say that liver regeneration. So the patient, when any person donates the liver to any patient, then the one lobe of the liver that is donated and that get hyperplasia, and this is called as hyperplasia. That is the classical example of hyperplasia. Second example, one is classical, this one, and now we will see about the bone marrow. Bone marrow also has the capacity to undergo rapid hyperplasia. Okay, and this occur in response of deficiency of mature blood cell. Like example, when there is acute bleeding or premature breakdown of red blood cell, like we will say, if anyone asks you that bone marrow, okay, there is rapid hyperplasia in response to the deficiency of mature blood cell, but when it can occur, then it occur in the acute bleeding या hemolysis. Then a feedback loops involve the erythropoietin and the growth of red blood cell progenitor, and that increases the bone marrow has so much capacity that it increases the red cell production to increase eightfold. Okay, this was all about the physiological hyperplasia. Now we are going to look about the pathological hyperplasia. Okay, pathological hyperplasia, it occurred due to most form of pathological hyperplasia, that is by the excessive or inappropriate action of hormone or growth factor acting on target cells. Okay, an example is what? Example is endometrial hyperplasia. Okay, endometrial hyperplasia, that is a type of abnormal hormone induced hyperplasia. In normal condition, what occur? There is the balance between the amount of estrogen and amount of progesterone. Okay, but in the pathological hyperplasia, the endometrium cell undergo very fast division, and this endometrium hyperplasia is the most common. It's very important. That is, it's most common cause of abnormal uterine bleeding. The second example, one is endometrium hyperplasia. Now second example is benign prostatic hyperplasia. Okay, it is also a common most example of pathological hyperplasia. In this, what happens? There is the hormonal stimulation. There is hormonal stimulation by the androgen. Okay, and this endometrium, this benign prostatic hyperplasia, this occurring is in response to the hormonal stimulation, that is the hormonal stimulation of androgen. This can be controlled, this can be controlled, and this can be regressed or stabilized. When it can be regressed, stabilized when the अगर उनके जो हार्मोनल स्टिमुलेशन है उसको अगर हम हटा देते हैं तो उसको हम लोग फिर से उसी प्रोसेस पे ला सकते हैं. Okay, after that this increased cell division that this is associated with the hyperplasia, that increase the risk of genetic abnormalities, aberration, and this can lead to the abnormal unrestricted proliferation and cancer. Okay, so we will write here that this increased cell division associated with hyperplasia elevate the risk of genetic aberration, lead to unsustained unrestricted proliferation, and that can lead to cancer. Okay, this, now I have said about cancer, but this cancer is very different from hyperplasia. Okay, but this pathological, which one? The pathological hyperplasia, that is that give a fertile soil in which the cancerous proliferation can eventually arise. Okay, and this you can write as important point. It is important point is that hyperplasia Hyperplasia is different from cancer, but it's important that pathological hyperplasia that constitutes fertile soil in which cancer proliferation eventually arise. So this patient with like example, we can see that this endometrium hyperplasia, that is hyperplasia, and this can lead to endometrial cancer. Okay, and this hyperplasia, this is one important thing, that hyperplasia can also occur due to some kind of virus infection like papilloma virus, which that caused skin warts. Okay, but but I mean to say, like other kind of hyperplasia, this kind of virally induced purification can also be a precursor of cancer. So okay, it is all about the hyperplasia. And now we will look about the mechanism of hyperplasia. Okay, this hyperplasia is the result of growth factor driven purification of mature cell, and in some cases increased output of new cell. In some cases it also occur, increased output of new cell from where? From tissue stem cell. Okay, what does this line mean? That growth factor induced the new stem cell, that from the new stem cell. Like example, like we have done the partial hepectomy, means that we have cut the partial reduction of the liver, and okay, then the patient has some half of liver. Okay, it was full, we have cut, and then this part of liver is remaining. Then the person is getting the growth factors, okay, from the liver, okay, and it activate the signaling pathway, okay, activated, and that stimulated the cell proliferation. Okay, but if the proliferation of liver cell, that is it does not, it is compromised, means ki itna activate nahi kar paya, then in that case the hepatocyte will be start the intrahepatic stem cell. Okay, means I mean to say that if this get compromised, that the division capacity of liver cell get compromised. Okay, it is compromised, that it occur in some form of hepatitis due to cell injury, then hepatocyte can regenerate from the intrahepatic stem cell. Where? From intrahepatic stem cell. Okay, so that it line means, okay, result of growth factor driven purification of mature cell. Not only growth factor driven purification, but in some case increased output of new cell from the tissue stem cell. This was all about the hyperplasia. Now we will look about other things.